this is a real story. She is a 25-year-old graduate student, actually going to be a physical therapist. She enjoys mountain biking, working out, reading, very active. She was injured while working out at the gym. She was doing kind of almost like a, maybe going back for a sit-up or something, and whacked the back of her head with a kettlebell. So she wasn't actually hit with the kettlebell. She hit the kettlebell with her head. So at first I was like, oh, this sounds like pretty intense. But she knocked the back of her head. At that time, she had no loss of consciousness, but was definitely immediately stunned. Felt like she had some headaches and some dizziness that did get better throughout the day. But as the days continued, she continued to have visual fatigue, poor coordination, difficulty focusing at near, which of course, as a graduate student, is all they do. And lots of computer work, which is very difficult for her as well. So this is my example. And a little background on me, I'm sure you guys have already known this, but I do work at a concussion clinic. So my caveat there is that I do have a lot of resources that I'm very grateful for, one of which is the neuro-optometrist that I work with. The way that our center works, I see the patients after they're seen by the neuro-optometrist. So they see the doctor first, evaluate that person for concussion, and then if the doctor suspects obviously a visual issue that is needs to be further addressed, they then refer to neurooptometry. She evaluates them, gives me an idea of what's going on from her diagnoses, and then hands them over to me to kind of work with some of that visual rehabilitation. With that, I do have a lot of other equipment and things like that because it kind of comes along with her being an optometrist, but I'm going to keep this with some things that anyone could do anywhere, even if they don't have all the other tools. So for this particular person, she had diagnosed her with convergence deficiency, saccadic eye movement disorder, smooth pursuit movement deficiency, and suppression of binocular vision. So I put the codes there as well for you if you ever needed to see those or know what they were. But I think these are really common with a lot of the patients that I see, particularly the first three, the CI, saccadic eye movement, and pursuits issue. Those are things that many of you might be able to catch on your own just with general OT-PT evaluation. And the suppression is a little bit more subtle, I guess. Definitely would be something that I wouldn't necessarily pick up to feel comfortable with a diagnosis on my own. She told me that it's there upon exam. The patient with, as testing persisted, demonstrated a little bit of that suppression. So I knew that was something that she had a challenge with from the get-go. So my evaluation hopefully is not too small for you guys to see, but I kind of took a snapshot of my eval and I threw it in this PowerPoint. Hopefully you'll have access to this and you can take from it what you wish, but I do have highlighted in orange there the assessments that I'm going to talk about mostly here, and then of course the therapy that goes along with that. So when I assessed her near-point convergence, she had a break and recovery at about 5 inches or 12 centimeters, and she had really poor tolerance with this. I remember her specifically really pulling back and wanting to not look at that tool, as I do test it about 3 times to kind of look at that sustained near-point of convergence performance. Her smooth pursuits and saccades, I graded as a 3 out of 4. My grading system, I kind of used grade 1 through 4. So it's sort of a muddled together idea between the NCUSO assessment, which is the oculomotor assessment, and then also what my optometrist and I kind of worked out. So 1 is poor, 2 is fair, 3 is good, and 4 is great, obviously. But she had some head movement, and she verbalized that she was kind of putting forth a lot of effort to be able to track the object as it came all around, side to side, and also back and forth to the 2 fixed objects. I did use the DEM with her. Her test scores were, as you can see here, not too terrible on test A and test B, but on test C, which is the one where the numbers are kind of randomly placed in the horizontal line. She had quite a bit of difficulty with that and took her over a minute and a half to complete, which is well outside of normal range for a 13-year-old person, which we're aiming for about 37 seconds with a standard deviation of 7 seconds or so. So I talk about what we did there in my first visit. In addition to the assessment, I kind of went over some exercises with her, which I'll discuss here soon. And I kind of documented that upon assessment, she demonstrated some binocular coordination issues, eye strain, headaches, convergence deficiency, and thus a limited tolerance for visually demanding activities. So I did think she would be appropriate for OT, and we started therapy.